Hello, welcome to Human Anatomy, Musculoskeletal System, brought to you by the Haybusak University of Yerevan, Armenia. I'm Dr. Akopian, and I'll be covering various topics related to the human anatomy. In the various sections that follow, the prerequisite knowledge required is the basic understanding of the anatomical terms, directions, and planes. The objective of this class is to familiarize the student with the human anatomy, the skeletal, muscular, and various other systems. The human skeletal system serves a great many functions in the body. It provides support, articulation, locomotion, for the entire body and various portions. The skeletal system is formed by two independent systems, the axial skeleton and the appendicular skeleton. The axial skeleton serves to support the head, the neck, the back, and the chest. It also forms the axial or the vertical axes for the human body. It consists of 80 bones, including the skull, the vertebral column, which includes the sacrum and the coccyx, the thoracic cage, which includes 12 pair of ribs, and the sternum with its components. The appendicular skeleton includes all of the bones of the lower and upper extremities and the bones that attach these extremities to the axial skeleton. All in total, 126 bones comprise the appendicular skeleton. The appendicular skeleton functions for locomotion, interaction, articulation, and support of the body. The lower extremities are also weight-bearing. The human skull comprises the facial component and the cranial component. The cranium has 8 bones, 2 paired parietal bones and temporal bones, occipital, frontal, sphenoid, and ethmoid bones. The facial component has the maxilla, palatine, nasal, inferior nasal conchae, zygomatic bones and lacrimal bones, which are paired, and the vomer and mandible. All in all, 22 bones. In addition to this, the skull also includes the hyoid bone and 3 each independent ossicles inside the external ear, 1 on each ear. If you break the human skull into 2 components, as I said, you have the cranial component and the facial component. If you further take a sagittal or a transverse cut of the cranium and look superiorly, you can see 3 fossa in the base of the skull. These are the anterior, middle, and posterior cranial fossas. Anterior, middle, and posterior cranial fossas. These fossas are formed by various bones of the cranial component and have various foramina or holes or openings through which pass nerves, arteries, veins, and each of these is an essential knowledge to understand the skull. All of the articulations in the cranium are immovable articulations known as sutures, except the mandible. The mandible articulates with a modified hinge or condylar joint at the temporomandibular joint. If you look at the human skull anteriorly and laterally, there are some essential landmarks we should be aware of. Anteriorly in the skull, you can be seen prominently the orbits. These house the eyes and the associated musculature, vasculature, and nerves. Midline to that is the nasal cavity, and the inferior mandible prominently shown here. with the inferior and superior alveolar processes. The zygomatic bones, which form the cheekbones, are also visible here. The orbits are formed by various bones and have various fissures and foramina, canals, which we need to study. In the lateral view, prominently seen is the mandible with its angle, ramus, and the body, the inferior and superior alveolar processes, the calvaria with the parietal, frontal, temporal, and occipital bones, the temporal fossa formed by the parietal, frontal, sphenoid, and temporal bone, and the pterion. The external auditory meatus is also visible adjacent to the temporomandibular joint. In the inferior view of the human skull, with the mandible removed, prominent features include the zygomatic arches, the hard palate, which is formed by the inferior surface of the maxillary bone, or the anterior 3/4 of the hard palate, where the posterior 1/4 of the hard palate is formed by the palatine bone. Here you can also see the floor of the skull formed by the occipital bone with a large opening called the foramen magnum. Lateral to it are seen the occipital condyles, which articulate with cervical vertebra number 1. Various meatuses, foramina can be seen, which we will study independently. As I said earlier, you have the anterior, middle, and posterior fossa, which house various foramina, openings, plates, and fissures. Each of these are passageways for various nerves, cranial nerves, branches of these nerves, arteries, veins, and various components. If you look at the cranial fossa in greater detail, in the anterior portion or the anterior cranial fossa, in the ethmoid bone can be clearly seen the cribriform plate. This sits superiorly to the nasal cavity and houses the olfactory nerve or the olfactory bulb, the cranial nerve number 1. Posterior and lateral to that in the sphenoid bone is the optic canal. The optic canal houses the optic nerve and the ophthalmic artery. Optic nerve is cranial nerve number 2. Inferior lateral to that is the superior orbital fissure, again in the sphenoid bone. This houses the first branch, the ophthalmic branch of the 5th trigeminal nerve of the cranial nerve, and the motor nerves that are responsible for innervating the eye muscles, oculomotor, 3rd, trochlear, 4th, and the abducens, 6th cranial nerves. Here also passes the superior ophthalmic vein. Inferior posterior to that is the foramen lacerum, which interestingly is filled with cartilage in life. Within the temporal bone can be seen the internal acoustic meatus. This meatus forms forward through the petrous process and extends anteriorly and laterally to form the external acoustic meatus, which is not seen here. The facial 7th cranial nerve and the vestibulocochlear 8th cranial nerve pass through this foramina. Also, the labyrinthine artery and vein are passing through the internal acoustic meatus. Within the occipital bone, lateral to the foramen magnum, is the hypoglossal canal. The hypoglossal canal houses the 12th cranial nerve, hypoglossal nerve. As we've seen already, the foramen magnum, spinal cord, vertebral arteries pass through here, and also the roots of the accessory nerve, 11th cranial nerve. Lateral to that are the jugular foramina. Here passes the glossopharyngeal nerve, vagus nerve, accessory nerve, and the internal jugular vein. Within the sphenoid bone are also seen the foramen spinosum, the carotid canal, and the foramen ovale and rotundum. The foramen spinosum is a passageway for the middle meningeal artery. The carotid canal, internal carotid artery. Foramen ovale and foramen rotundum house the third mandibular division and a second maxillary division of the trigeminal nerve as they pass through these foramina to innervate the face. Understanding the individual bones of the cranium, we need to look at the components and its function. The cranium forms as a brain case to handle or contain the brain in the cranial cavity. Superiorly, it is bound by the calvaria. Inferiorly, forms the base of the skull. As I said earlier, 3 fossa, anterior, middle, and posterior. The bones that form the brain case, or the cranium, are the 8 bones that we discussed earlier. Pair of parietal bones, pair of temporal bones, occipital, frontal, sphenoid, and ethmoid bone. The parietal bone. The parietal bone are a pair of bones that form the superior aspect of the cranium. Midline, they form a articulation with each other via the sagittal suture. Inferiorly, they're bound by the temporal bone at the squamous portion and the sphenoid bone through the squamous suture. Anteriorly, they are bound to the frontal bone via the coronal suture, and posteriorly, they're bound to the occipital bone via the lambdoid suture. These are the temporal bones, which we will study in 3D next. The temporal bone forms the inferior lateral aspect of the cranium, and it has 4 components or 4 parts. The squamous part forms an articulation with the parietal bones and the sphenoid bones through the squamous suture. The mastoid component houses the mastoid process and forms an articulation with the occipital bone. The anterior portion is the zygomatic portion, which has the inferior mandibular fossa, which articulates with the condyle of the mandible to form the temporomandibular joint. Posterior, inferior to that, is the external acoustic meatus. This is the ear canal. Inferior and deep to that is the styloid process. Now, let's take a look at those 2 bones, the parietal bone and the temporal bone, in our 3D model. This is your human skull. In this 3D model, you can see very clearly the 2 parietal bones, right and left, which form a articulation midline superiorly via the sagittal suture. Anteriorly, they form a articulation with the frontal bone by way of the coronal suture. Posteriorly, via the lambdoid suture with the occipital bone. Medially or laterally, they form an articulation with the temporal and sphenoid bone via the squamous suture. These are the parietal bones. The next bone is the temporal bone. As we said earlier, the temporal bone is the lateral inferior part of the cranium, and it has 4 component parts. The squamous component, or the squamous part, which forms the articulation with the temporal and sphenoid bone via the squamous suture. The mastoid component, or the mastoid part, which forms an articulation with the occipital bone posteriorly. The anterior portion, which is the zygomatic portion, which forms an articulation with the zygomatic bone to form the zygomatic arch. Mid and inferior to the zygomatic portion is found the mandibular fossa. The head, or the condyle of the mandible, articulates here to form the temporomandibular joint. Posterior to that is found the external auditory meatus, and deep inferior to that is found the styloid process. Isolating the temporal bone, you can see deep in the structure the fourth part, the petrous part. The petrous part houses the internal ear components, vestibular and cochlear components. Here you can see the internal auditory meatus, which houses the vestibulocochlear nerve. The temporal bone. Frontal bone. Frontal bone is a single flat bone that forms the forehead. It extends into the hairline and forms an articulation superiorly with the parietal bones via the coronal suture, as we've seen already. Prominent feature is the glabella, a depression in the anterior midline. The frontal bone forms the superior ridges of the orbit and also the roof of the orbits. Superficially, midline, it articulates with the nasal bones and the maxillary bone. Laterally, it articulates with the sphenoid and the zygomatic bones through the zygomatic process. Lateral to the glabella, within the supraorbital ridges, can be found the supraorbital notches or the supraorbital foramina. Through these supraorbital foramina pass the first branch, the ophthalmic branch of the trigeminal nerve. The frontal bone. A single bone, flat bone that extends into the hairline, forms an articulation with the parietal bones through the coronal suture. Laterally, it articulates with the sphenoid and the zygomatic bone through the zygomatic process. Superficially, anteriorly, it articulates with the facial bones of the nasal bones and the maxillary bones. The glabella is seen as a prominent depression between the eyebrows. The frontal bone forms the superior ridges of the orbit and also the roof of the orbit. Lateral to the glabella, midline, can be palpated the supraorbital foramina, or notches, as we said earlier, through which passes the first branch, ophthalmic branch, of the trigeminal nerve. Frontal bone. The occipital bone is a single bone, forms both the posterior aspect of the cranium and also the base of the cranial cavity. Midline posteriorly and inferiorly can be palpated the external occipital protuberance. Lateral to that are the superior and inferior nuchal lines. These serve as attachment points for various muscles of the head and neck. Midline and inferior can be seen the occipital condyles, which are articulation points for the first cervical vertebra, the atlas. Midline to these condyles is the foramen magnum, not shown in this image, And lateral and anterior to that are two foramina, which we will see in the 3D model. This is the occipital bone. As we see, the occipital bone is a single bone that forms both the posterior of the cranium and also the base of the cranial cavity. Posterior superiorly, it forms a articulation with the parietal bones through the lambdoid suture. Laterally, it articulates with the mastoid portion of the temporal bone. Inferior and posterior can be palpated the external occipital protuberance. Superior laterally and inferior laterally to that lie the superior and inferior nuchal lines. Again, these serve as muscle attachment points. Midline at the center or the base can be seen the foramen magnum for the spinal cord. Lateral to that are the occipital condyles, which articulate with cervical vertebra number 1, atlas. Lateral to that is seen the hypoglossal canal, which is the passageway for the hypoglossal nerves. If we isolate the occipital bone, we can see its structure in greater detail. You can see from the superior view how it forms the posterior cranial fossa. Lateral to the foramen magnum are the hypoglossal foramina, through which pass the hypoglossal cranial nerve. Lateral to the condyles are seen the internal jugular veins as they pass through the jugular foramina. The occipital bone also articulates with the sphenoid bone midline. This is the occipital bone. This is the sphenoid bone, also known as the backbone. It's a single complex bone that serves as the keystone at the center of the skull. Internally, the greater wings form the ridge between the anterior and middle cranial fossa. The sphenoid bone forms much of the base of the central skull. Midline can be seen a bony saddle-like structure called the hypophyseal fossa or sella turcica. It houses the pituitary gland. Laterally, the greater wings also articulate with the temporal bone on the exterior at the squamous portion and form a rectangular area. Inferiorly and bilaterally are found the pterygoid plates, the medial and lateral pterygoid plates. The medial pterygoid plates serve as the posterior lateral walls of the nasal cavity, and the lateral pterygoids act as muscle attachment points for the pterygoid muscles of the mastication. Lateral and anterior to the hypophyseal fossa is found the optic canal. Optic canal serves as a passageway for the cranial nerve number 2, optic nerve. Just under the lesser wings, inferior to it, is found the superior orbital fissure. The superior orbital fissure serves as the passageway for the nerves that innervate the eyes or the muscles of the eyes, which include the oculomotor nerve, the 3rd cranial nerve, the 4th cranial nerve, which is the trochlear nerve, the 6th cranial nerve, abducens, and the 1st branch or the ophthalmic nerve of the trigeminal nerve. Through the superior orbital fissure also pass the ophthalmic veins. The sphenoid bone also has foramen rotundum, which serves as a passageway for the second branch of the trigeminal nerve, maxillary nerve, the foramen ovale, which serves as a passageway for the third mandibular branch, and the lesser petrosal nerves, and the foramen spinosum. Foramen spinosum serves as the passageway for the middle meningeal artery. There's also a foramen lacerum, not shown in the image, which is actually filled with cartilage in life. Now let's take a look at the sphenoid bone in our 3D model. You can see clearly here that the sphenoid bone serves as the keystone or the central portion of the cranium. As you can see, the greater wings extend outward laterally to form an articulation with a temporal bone at the squamous portion. The sphenoid bone also serves and contributes to the posterior wall of the orbits. If you look internally, you can clearly see the optic canal, through which passes the optic nerve, cranial nerve number 2. Inferior to that is seen the superior orbital fissure, which we mentioned earlier houses the nerves that innervate the muscles of the eyes. These include the abducens, trochlear, and oculomotor nerves. Also, the first branch of the trigeminal nerve, the ophthalmic branch, which then extends out and comes out through the superior orbital foramina. Now, what I have done is removed several bones, including the frontal and the parietal bones, so we can get a better, clearer view of the sphenoid bone. If we rotate the model so we can look at it superiorly, you can clearly see the sphenoid bone with its structure. Here in the middle, you can see the hypophyseal fossa, the pituitary gland. Lateral and anterior to that, you can see the optic canals. Inferior to that, you can see the superior orbital fissure, the foramen rotundum, foramen ovale, and foramen spinosum. You can also see that the sphenoid bone articulates with the ethmoid bone anteriorly. Now, well, it's fair. Well, it's fair. Since we have a bat bone, why not have a butterfly bone, right? This is the ethmoid bone. The ethmoid bone is a single complex midline bone. It forms the roof and the lateral wall of the upper nasal cavity, the upper portion of the nasal septum. It contributes to the medial wall of the orbit. The perpendicular plate extends downward to form the nasal septum with another bone, the vomer. Extending from each lateral wall are the superior and middle nasal conchae. As I mentioned earlier, the inferior nasal conchae is an independent bone. Inferiorly, it forms the midline part of the anterior cranial fossa, which also becomes the roof of the nasal cavity, has two parts, the crista galli and the cribriform plate. Both of these structures are actually inside the cranium proper. The cribriform plate houses the olfactory nerve, or the olfactory foramina, which is cranial nerve number 1. The crista galli serves as the attachment for falx cerebri, the meningeal dura. Lateral portion of the ethmoid form the medial aspect or the medial orbit wall. and lateral nasal cavity. The ethmoid, the body of the ethmoid bone, also contains the ethmoid cells or ethmoid sinuses. Here's the ethmoid bone in the 3D model. As you can see, it is a single midline located bone. It forms the medial wall of the orbit. The perpendicular plate extends downward into the nasal cavity and forms the nasal septum with the vomer bone. If we were to hide some of these bones, the facial bones, nasal, and the maxillary bones, you can see the ethmoid bone much clearly. As I said, it houses the superior and middle nasal conchae, whereas the inferior nasal conchae are independent bones. We further remove the frontal bone, and we can see superiorly to that the cribriform plate. The cribriform plate, as I said, houses the olfactory nerve or olfactory bulb, and midline to the cribriform plate is the crista galli. There is the ethmoid bone. Okay, let's switch sides now. Okay, let's discuss the facial bones. The facial bones. There are 14 bones in the facial structure. They are paired maxilla, palatine, nasal, inferior nasal conchae, zygomatic bones, lacrimal bones, and an individual vomer and the mandible. The maxillary bone, or the maxilla, are two bones that are fused midline and form the upper jaw. The superior surface of the maxillary bone forms the orbit floor, and the inferior surface of the maxillary bone forms the anterior 3/4 of the hard palate. The posterior 1/4 of the hard palate is formed by the palatine bone. The maxillary bone has palpable alveolar processes, which form the upper teeth, a zygomatic process by which it articulates with the zygomatic bone. Superiorly and anteriorly, it articulates with the frontal bone and the nasal bones. Inferior to the orbit, the infraorbital ridge, is found the infraorbital foramen. The infraorbital foramen is the passageway for the second maxillary branch of the fifth cranial nerve, trigeminal nerve. The midline perpendicular plate, not shown in the image, forms the upper nasal septum. The palatine bones, as I said earlier, form the posterior 1/4 of the hard palate, are a pair of irregularly shaped bones that contribute small areas, the lateral wall of the nasal cavity, and the medial wall of each orbit. Inferiorly, as I said, the largest regions form the two horizontal plates which join together as the posterior 1/4 of the hard palate. These are the maxillary bones, two bones fused midline. You can see clearly the articulation with the frontal bone, the nasal bone, the fact that the zygomatic process interfaces or articulates with the zygomatic bone to form the cheekbone. The superior surface of the zygomatic bone forms the floor of the orbit, and the inferior portion forms the anterior 3/4 of the hard palate. Inferior to the inferior ridge of the orbit, is found the infraorbital foramina, one on each side, through which pass the maxillary branch of the 5th cranial nerve, trigeminal nerve. The maxillary bone also forms an articulation with the independent inferior nasal conchae and the vomer, which forms the central nasal septum. Maxillary bone. The zygomatic bone, or the cheekbone, are paired bones which form the lateral wall and the ridge of the orbit, and also the lateral inferior margin and the anterior orbital opening. The zygomatic process articulates with the zygomatic process of the temporal bone to form the zygomatic arch. The nasal bones are two paired small bones that articulate superiorly with the frontal bone, laterally with a maxillary bone, to form the bridge of the nose. By the way, this is what's broken when you have a broken nose. The lacrimal bone is a rectangular bone that forms the medial wall of the orbit, articulates with the ethmoid, frontal, and maxillary bones, houses the lacrimal canal, through which passes the lacrimal duct that drains the tears into the inferior nasal concha. When you cry, the tears drain into the posterior of the nasal concha, but with pressure and increased tears, they flow anteriorly, and this is why you have a runny nose when you cry too much. By the way, next time somebody's crying, be professional and ask them to stop lacrimating. The inferior nasal concha, two independent bones, right and left, curved bony plates, project into the nasal cavity to form the lower lateral wall. They can be seen by looking into the anterior opening of the nasal cavity, and they are the largest of all nasal conchae. And finally, the vomer bone, which is a triangular-shaped irregular bone. It forms the posterior and inferior part of the nasal septum as it articulates with the perpendicular plate of the ethmoid bone. Best seen by looking from behind into the posterior opening of the nasal cavity. Zygomatic bone. The zygomatic bone, pair of them, are your cheekbones. They articulate with a maxillary bone to form the cheek bones. Posteriorly and laterally, they have the zygomatic process, which articulates with the zygomatic portion of the temporal bone to form the zygomatic arch. Superiorly, again, they articulate with the frontal bone. They form much of the lateral wall and the lateral and inferior ridge of the orbit. The nasal bones, two paired rectangular bones, which form the nasal bridge. They articulate superiorly with the frontal bone and medially or laterally with the maxillary bones. The lacrimal bone is a small rectangular bone which forms the medial wall of the orbit, in conjunction with the ethmoid bone. They articulate with the frontal, ethmoid, and maxillary bones, and house the lacrimal canal, through which the lacrimal duct drains tears into the inferior nasal conchae. The nasal conchae, inferior nasal conchae, are the largest conchae, individual bones that form much of the lateral walls of the nasal cavity. The vomer bone separates the nasal cavity into left and right compartments, forming the nasal conchae, articulating with the perpendicular plate of the ethmoid bone. The mandible, lower jaw. It is the only movable bone in the skull. At time of birth, there are two bones. They fuse in the first year. Palpable angle of the mandible separates the ramus and the body of the mandible. Each mandibular ramus projects into two bony projections. The posterior projection terminates at the mandibular condyle, and the anterior projection terminates at the coronoid process, separated by the mandibular notch. The mandibular condyle articulates with the mandibular fossa of the zygomatic portion of the temporal bone to form the temporomandibular joint. The coronoid process is an attachment point for the large mastication muscle known as the temporalis. Now, some important landmarks of the mandible include the alveolar processes, which form the inferior or the lower teeth, the anterior mental protuberance, which forms your chin. The lateral to the mental protuberance are the mental foramina, which house the mental nerve, mental branch of the fifth cranial nerve, the third branch. The mylohyoid line, which is midline anterior and inferior, for the mylohyoid muscle attachment, which forms the floor of the mouth. The mandibular foramen, which is on the midline of the ramus of the mandible, medially, houses the inferior alveolar nerve, another branch of the fifth trigeminal nerve. Sensory nerve and blood vessels that supply the lower teeth enter this mandibular foramen and follow the length of the mandible. In order to numb your lower teeth, the dentist will often inject anterior to that anesthesia for the lateral wall. The last part is the lingula, which is also known as the little tongue. It's a small flap of bone. That is the attachment point for the sphenomandibular ligament. And here is the mandible. As we said, the mandible is the only articulating bone in the head. It has the body of the mandible, the ramus of the mandible, which projects into two distinct projections, posterior of which is the condyle of the mandible, which articulates with the mandibular fossa to form the temporomandibular joint. The mandibular notch separates the coronoid process, which is a flattened projection anteriorly, inside and inferior to the zygomatic arch. That is the attachment point for the temporalis mastication muscle. The anterior is the mental protuberance, which forms your chin. Lateral to that are the mental foramina, which house the mental branch of the fifth trigeminal nerve. And inferior and midline is the mandibular notch which, as I said, is another branch of the trigeminal nerve, which innervates the lower teeth. Mandibular bone. You can see clearly here the mandibular bone as it elevates and depresses through the temporalis muscle. As we said earlier, the temporalis muscle originates in the temporal fossa and inserts into the coronoid process of the mandible. You can also see the articulation, of course less the ligaments and the articulation surfaces, of the condyle of the mandible with the mandibular fossa of the zygomatic arch. Last but not least, the hyoid bone. The hyoid bone is an irregular U-shaped bone that is inferior and midline to the mandible. It is a non-articulating bone. It has no articulation with other bones. It has two prominent features, the two greater and two lesser horns, and the body. The greater horns point posteriorly and are level with the cervical vertebra 3 and 4. The anterior horns attach to the styloid process by way of the stylohyoid ligament. Now, to summarize, let's take a look at the orbit again and understand the surface and other features of the orbit. It is a bony socket that houses your eyeball, contains the muscles that move the eyeball. It is a cone-shaped structure with a narrow posterior and wide anterior. The middle wall, the medial wall of the orbits are parallel, whereas the outer walls are at an angle of 45 degrees to each other. 7 bones contribute to the walls of the orbit. The roof of the orbit is the frontal bone. The zygomatic bone forms the lateral wall of and the floor of the orbit. The maxilla and the palatine bones form the medial floor of the orbit. The ethmoid and lacrimal bones form the medial wall of the orbit, and the sphenoid bone forms the posterior wall of the orbit. There are openings including the optic canal, which passes the cranial nerve number 2, optic nerve, and the superior orbital fissure, which has the motor nerves for the muscles of the eye, including the oculomotor, trochlear, abducens nerve. The lacrimal, frontal, and nasociliary branches of the ophthalmic nerve, 5th nerve branch 1, and the superior ophthalmic vein. Now, the paranasal sinuses. These are hollow, air-filled pockets within the various bones of the facial and cranial bones that are lined with nasal mucosa. They communicate with the nasal cavity and reduce the weight of the skull, also resonate the voice. If the resonant component is not present due to colds or inflammation or these recesses being filled with fluid, your sound will be like this, very nasal. This is one of the key reasons why these nasal, paranasal sinuses must be kept clean. The frontal sinuses are in the frontal bone, superior and lateral to the midline. The maxillary sinuses are the largest, located bilaterally in the maxillary bone, superior to the superior alveolar processes. The ethmoid and sphenoid sinuses are in the respective ethmoid and sphenoid bodies. The last bone in the head and neck is the lonely bone, the hyoid bone. The hyoid bone is an independent bone, does not articulate with any other bone. It is a U-shaped bone that is pointed posteriorly with the greater horns towards the C3, C4 cervical vertebra. It has the attachment through the lesser horn by way of the stylohyoid ligament to the styloid process. The three dynamic compartments, the floor of the oral cavity superiorly, larynx inferiorly, and the pharynx posteriorly. This concludes the lecture for the cranial and facial bones and their structures. Thank you.